All right, welcome back to Daybreak. Of course, the conversation continues in as far as the questions that you have, and to try to get as much information as possible in as far as understanding the coronavirus. I had said that I was going to try and see what star 719 hash has to do. Unfortunately, you cannot see this on screen, but let me just try and see where it leads me. As star 719 hash takes me to a site where it says, "Welcome to Ministry of Health Coronavirus COVID-19 Information Center." I choose English because Daybreak is an English show. Not really, we use English to do this business. What is COVID-19 is the first item. You type 1 to get that information. Number 2, they are saying misconceptions and facts. Number 3 is how it spreads. Number 4 is signs and symptoms. Number 5 is how is it prevented. And then 6, advice to visitors and travelers. Then 7 is self-quarantine. I want to see how is it prevented. So let's click number 5 and see what you have. It says that I reply with any number below for more information. That is, number 1, you can wash your hands. Number 2, you can use disposable tissue. Number 3, you can keep distance. I'm trying to do that. Number 4, you can avoid contact. And number 5, you can stay at home. So let me see. How do you wash your hands? Number 1 takes me to, I wish you could see this on screen, but also try with me. Star 719 and follow through. So wash hands regularly with soap and running water, or use an alcohol-based hand sanitizer. And it ends there. So the question of hand sanitizers and what you're saying, the complaints across the country that it has been overpriced. You're told that there are some business persons that are taking advantage of the situation. I mean, what is a medical officer, someone who has practiced public health, what would be your advice to Kenyans who are struggling with the cost of these sanitizers yet they want to stay safe?
Right. So as Zinzi said, what the Ministry of Health is advocating for, what WHO is advocating for, what CDC is advocating for is begin with hand washing. That's actually effective. And it's important to note that hand washing is not necessarily going to pick the most antibacterial soap in the market. The Panga soap that we all know of is actually effective. You just need to ensure that you have the water. Of course, it's safe and clean water, and that you're able to actually undergo through the maneuver of hand washing. I think the next time I'm engaging with you, I should come with a bucket and this Panga soap so that I can demonstrate to you how you do this. But essentially, it is you take the soap and you ensure you're going through all the surfaces of your hands, and you're systematically ensuring each section of your hand is actually engaging in that rubbing contact. And then you rinse your hands and you repeat it again, and we're recommending that people do this for 20 seconds. Hand washing is effective. Panga soap, Sunlight, all the soaps that we have there in the home are actually effective.
I think that is a very good point, 20 seconds, because people just tend to do this.
Exactly, exactly. Now, hand sanitizers. Hand sanitizers, in fact, in the medical world, were put in place for certain, should I say, environments for the hospital. Perhaps when you're moving from bed to bed during a ward round, when you're moving from one area in the hospital or lab into another area. So these are almost what I'd call should I say, medical industrial measures of hygiene. Remember, when you're working in a hospital and you have 50 patients in a ward, you're not going to keep washing perhaps your hand after each and every patient. And that's why hand sanitizers were put in place. Hand sanitizers are not effective if you've soiled your hands with dust and, dirt and soil, and you put a sanitizer on top. Of course, that wouldn't be useful. So I think that Kenyans need to realize that basic hand washing with Kipanga soap is good enough.
So here's the thing, Dr. Does the Ministry of Health also know the status of the 100 Kenyans in China? 91 are students, 9 were acrobats. Do you also know the status of Kenyans in Italy and Iran? Those 3 countries for obvious reasons.
Yes, so Zinzi, so the NERC, again, the National Emergency Response Committee, actually has the participation of the Ministry of Foreign Affairs and the Ministry of Interior and Defense. And through Foreign Affairs ministry, this ministry is engaging with Kenyans across the world, engaging with them, finding out where they are and how they're doing, and managing that situation. It's important to note that we have to ensure that we note that we live in a global world, a global village. And because this is a pandemic, all countries actually are heightened and are actually being very responsive in ensuring that different citizens who are across different places across the world are being taken care of.
So but I want to believe the Ministry of Health, the Kenyan government, is taking a precaution to actually find out how Kenyans in China.
So yes, the Ministry of Foreign Affairs, because this is a diplomatic cross-border country issue, is well seized of this issue and is engaging on that front. Yes.
And of course, so many questions that we have for Zach. So then, even as that question about the students in China, it brings you to the focus on the independence of a country, because look at it, we have told that this pandemic will affect the import business, because it affects the airline industry, it will affect the tourism sector. I mean, are there specific things that the government is thinking about so as to make the country independent? So the next time such a thing happens, it does not, we do not take such a hit as we're just about to.
Well, in this world of global villagism, it is not right to say any country can be entirely sufficient on anything. The high level of interdependence is encouraged, especially in business, in economy, in tourism, in airlining, as you're putting it, because no country can live on its own. No country can be an island. It used to be before, in the era of world wars, but now it is not possible. So then, what is the government thinking about? Something she mentioned here, I would want to reiterate. These hand washing detergents and the sanitizers. We have seen rogue business people who want to take advantage of the situation and hike the prices. We have seen also shops that would want to hike the prices of commodities, and these are things that are basic. The government is keen and careful to ensure that no inflation of prices is done. And the Competition Authority, the President announced on Sunday, is on the lookout to ensure that nothing has been taken out of context to take advantage of the situation the country is right now.
Right.
As we continue to ask our business people in the country to manufacture more of what we need now, we are seeing requests coming from business people about tax waiver.
Right.
Perhaps that is what you're asking, what the government is going to do to ensure that we are cushioned. They are asking for tax waiver so that the things they are manufacturing for us are able to be, rather they are provided to the people at affordable prices. And I know that request is well served, and the President perhaps will be looking at that issue in a deeper manner to make announcements that are fitting to the people, to help our people. Ensure that they fight through this period. To say that the government in the future can do something to ensure that we are contained, I would not be forthright to say any country, including America, Britain, Japan, can do that in the future to ensure that they are only sufficient on themselves to ensure, to fight any pandemic, if I would say it, against their own people. Look at it today. If this thing started in Africa, we would be blamed that we are primitive. You know, we started, Africa is doomed to fail.
Do you want to go there,
Africa, I tell you, but no, but I'm just saying, if it started here in Africa, we would be blamed by the other world. But look at the first world, Italy, the Rome, a country that ruled this world for over 400 years, are the worst hit. Look at the China, look at America, look at Britain, everywhere. The West is in lockdown. Africa, we are actually trying. The worst case is Egypt.
I see you. I see you,
we are trying, and Kenya is trying more than other African countries because we have no case of death cases so far.
Right.
We only have 3 cases that are being monitored, and other people admitted. We are doing well.
All right. So someone wants to show us a few numbers. As I allow him to do that, Daktari, here's the thing that we are not talking about when it comes to coronavirus. More specifically, those who are isolated or quarantined. Now that we now know the difference, courtesy of you, Daktari, what happens to the mental aspect of when one person is either isolated or quarantined? China has a hotline for those who are mental health hotline during this time when they're quarantined or isolated. Here in Kenya, Senator Sylvia Kasanga has a mental bill which today still hasn't been passed. Why are we ignoring the mental aspect of this?
So Zinzi, I would say that mental health is critical, it's important, and mental health is something that the government is observing and ensuring that measures are put in place. One, for health providers.
Yes.
You have health providers who are our frontline heroes who are engaging with this. You can imagine that some of these health workers, as we've seen in China, are having to work double shifts to ensure that they're there and they're actually serving the ones who are sick. These health workers have patients, these health workers have families, children. So you can imagine the anxiety that would come into play. Now, even for those who are under isolation and quarantine, you know, it's an unknown situation. You can imagine, you know, the levels of anxiety across the world when it's said that you have coronavirus. So indeed, this is something that we need to pay attention to, and we have. So the government has been able to engage with its psychiatrists and its psychologists who are in place. The teams in Bagavi, both the patients there and even their families are engaging with some of the well-renowned psychiatrists we have in the country. And I'm happy to say that through the Kenya Medical Association, the KMA, yesterday, some of these health providers have actually offered to come in and actually provide some of these services for Kenyans and for families. And I'm also happy to say that, again, through the KMA, they're willing to engage and actually even set up a call center that offers psychological services. And Kenyans, even you and I, who may become anxious when we're at home, can actually call in. So this is something that we'll be rolling out shortly, and we have a team of doctors who are happy to support this.
Sam, you know what they say, a country's health is her wealth.
Health is wealth. So we take a look at what the numbers are. And Daktari, as I was telling Zinzi earlier on, yesterday when we were closing the show at 10 o'clock in the morning, we were at 169,000 coronavirus cases. Now this has risen to 182,695, and the numbers are rising. And I can assure you by the time we are concluding the show at 10 o'clock, the numbers will have risen. But also we are noticing something in China. The death rate is reducing. And also the new infections are reducing, because we've been at 80,000 for quite some time now in China, but Italy obviously has been rising, and the number of deaths has also been rising. Kenya remains at 3, just as it was announced on Sunday by President Kenyatta. Here it is, Kenya is here. No movement in terms of recoveries or moving to the serious or critical side. So have we been able to study and see what China is doing that has helped the slowdown in new infections? And even as you respond to that, talking about this this ward, the isolation and treatment ward, just how exactly are they isolated? I remember looking at pictures of Ebola, the management of Ebola. You would see those people, they are in screen. So every patient, they are within their own screen. Is it the same here, or it's not that contagious to warrant that?
So China has made progress, remarkable progress and commendable progress, and that's why you're seeing their numbers, you know, starting to take a nosedive. And part of this is because of the measures that they've employed. And we must say that here in Kenya, the president did well to put in place the measures that he announced recently. And some of these measures are the ones that were put in place in China, ensuring that we're protecting our children, ensuring that there's social distancing between ourselves, talking about the hand washing. All these interventions have aided to see the drop that you're seeing there in China. And this is what we need to also employ within the country so that our numbers remain at that rate and we don't have an increase in numbers. Now, with regards to the facilities, I think we were all able to see that China put in place, you know, units within 7 days. And also came in and looked at stadiums and different, you know, gymnasiums, and were able to convert those into quarantine centers. Like I said, the distinction between quarantine and isolation is very important, and especially in a space where perhaps this is one of the newest and most, should I say, heightened global pandemic response, to put up some of these centers to ensure that they're actually isolation centers would require an inordinate amount of resources. I think China, they themselves were able to come forward and say, you know, this is what we've had to do. When it's a tough situation, you do what you have to do. And that's what they did. I'm pleased to say that in Kenya, we do have the adequate IDHU unit that actually has isolation centers. And these isolation centers are centers where you're hoping to prevent the virus from going outside the room. And this is in place. For quarantine, remember, these are people who have not tested positive, right? But they've come into contact. So you want to reduce that, should I say, risk of transmission. And perhaps even more importantly, I think you've heard us talk of self-quarantine. And I have with me here a health information pack that I'd love to share with you. I'll be leaving this with you. And this pack is actually sharing how self-quarantine can look like at home. So what happens if we say you need to self-quarantine at home? You know, and it talks of the rooms, how you arrange that within your house. How you disinfect surfaces within the house, how you ensure that you've made arrangements to avoid as much transmission and contact within the home.
But
and indeed, Zinzi,
informal settlements.
So Zinzi, indeed, and I knew that was the next question you were going to bring about what happens to the people who are living in one-room houses.
Yes.
And like I said, this is a global pandemic issue that has come about. What we are advising is when you're within that house, then one, it's important to know, yes, we're in this household, this room, and we are 7 of us. Therefore, then, we all quarantine and limit that contact with the outside world. Now, I know this will pose difficulty in different institutions. I've had people say that some of us have to go out to work and to be able to, you know, be able to fend for ourselves and whatnot. We appreciate that. Government is aware of that. Of course, this is Africa. Africa is a dynamic population with a huge informal sector. And so what we're saying is do that hand washing. You know, practice cough and etiquette hygiene, ensure that you're able to actually account for the people that you're coming into contact with, even if it's in terms of perhaps knowing you visited this space, you are here, you are there, because that's what we need to do. We are Africa and we have to take dynamic steps to understand how our continent is and to be able to actually have a response that's suited to our continent.
Right.
And this is what the National Emergency Response Committee is working on.
Okay.
Now, Sam, I
know there's a pending question. I want us to take a look at the feedback so that you can we can release you. If you have the feedback that we have been receiving. Joseph Martin, I'm concerned citizen from Nyamira County. Would like to know if it is safe to use boda boda to ferry students from nearest school to their homes. Of course, you might have to touch on that. Yeah. Nixon from Kindaruma.
You say, are all our local dispensaries really well equipped already? Because that's where we rush first when attacked by Homa. Okay.
Well, Kirago David, you say because we are told to self-quarantine, what we do at night because some people sleep. Okay. Should we avoid sleeping together? That's David Kirago. Okay.
Rosemary, you say morning. Good morning to you as well. I'm glad you've brought up this show. Dr. Mercy has just mentioned about hospitals. Yes, they have some sanitizers right at the door, but let them allow us to continue visiting our patients, because they said no more visiting, but exercise thoroughly the hygiene measures and continue educating people.
That's a concern, Kenyan. Then Engineer Lazaro, you said that Dr. Ish, should WHO caution people against eating some dangerous poisonous animals like snakes, bats, primates, etc. I fail to understand how some people would just decide to eat the bats while the population of poultry is overwhelming worldwide. That's someone who knows that the coronavirus originated from animals.
You don't say your name, but you say, has coronavirus affected importation of goods from countries like UK, and can imported goods transfer the virus?
All right, so I don't want to ask any specific question, just closing remarks from you, Zach, then Dr. as you end up.
The last question here, whether importing of goods can transport the virus. The question, yes, because it can rest on service, hard or soft. That virus can rest on hard service for about 9 to, she knows better, I'm not a doctor, but 9 to about 12 hours. And within that time, if it comes to contact with your fluids, then it can carry it. The container, the car, the toys, food, the ceramics, whatever, cutlery, whatever you're bringing out to where you are and it carries the virus, it is possible. So therefore it is possible to carry the virus on hard service actually, and even soft service. That is one thing.
Right.
This person coming from Homa Bay, let me tell them, we are trying to ask our fellow Kenyans to ensure scare. They are not scared. To ensure that this health scare that is not informed does not inform their decision. Because asking whether a motorbike it's safe to transport students from point A to point B, I would say yes and no. Because All we are saying is this virus called corona can be anywhere. It can be on motorbike, it can be on motorbike rider, it can be on a passenger. The first important thing to know is that you don't know until it is confirmed that the rider or the bike contained the virus. So take prevention measures.
All right.
Whether you're transporting children from school to home or from home to school, of course now it is suspended.
Yes.
Sure.
No students or no people should travel.
Yes.
But the fear is the other people who are traveling could be business people, now non-student and non-people.
All right.
Sanitize your hands before, sanitize your hands after, and take preventive measures. Otherwise, if you know the rider has coronavirus, avoid that bike.
Right, Dr.
If you know.
Right, Dr. Your
Yeah.
closing statement as well. But
Right.
I would love for you to also answer on that question from one of our viewers. I thought that was a fantastic question. Should the World Health Organization caution people from eating certain meats? We know where coronavirus, all the myth around it is that it came from the bats in China. As you also give us your closing comment.
So there are teams that are studying the genesis of coronavirus, and in as much as there's been an association with bats, it's important that we give these teams time to be able to actually define for us how that transmission was able to jump from the bats to humans. But it's important, you know, as Kenyans and as individuals and globally, that we respect different cultures. Different countries, different people exhibit different cultures, and
Right.
it is their right,
Right.
to be able to live within their means and to
Right.
live within the cultures that they demonstrate. So to question what people eat and how people live perhaps may be beyond even individual merit for us to be able to do that. What we are saying, however, is now that we're here, we're dealing with coronavirus, can we ensure that we're engaging in the prevention measures that are in place and that we're actually, how do I say, being proactive in our response? Allow me, in terms of my parting shot, to just emphasize that hand washing is what we need to be doing, Kenyans. We need to be using that panga soap. We need to be doing this for those 20 seconds. And then we need to be practicing cough etiquette, you know, hygiene when you're coughing. And then we need to be proactive, as our index patient was, in going to seek care when you actually
What is
feel
that cough
that you
etiquette, if
have
you could just
symptoms.
indicate?
Sorry?
The
Cough etiquette.
etiquette.
Right, so cough etiquette would mean that should you have a cold, and remember, just because we are having corona does not mean that the other colds are not still circulating in the country, here in Kenya and across the world. So cough etiquette would mean that, one, if you're coughing, you're able to actually use your elbow as opposed to using your hands, because your hands always come into contact with your face, with your eyes, and with surfaces, and that's how then it's transmitted. Two, if you are actually having those flu symptoms, stay at home if you can. Remember, through the executive team that was put in place and the president's speech, or is it a day yesterday, he actually said, let's allow people to work from home when they can work from home.
Right.
So I'm actually looking forward to seeing when citizens can stream from home. And perhaps we would be having these questions when I'm in the house, or perhaps in the hospitals, ensuring that everyone is safe.
All
So
right.
thank you. Wash your hands.
For final
Kenyans.
appeal, perhaps
Yes.
because of education here. The children you have sent from school to home must not be automatically interpreted to mean that home there are no risks of transmission.
Sure.
Parents are advised, and guardians, to minimize outdoor activities for the children as much as possible, and for the young adults in high school and international, you know, systems of Form 5, Form 6 should minimize their contact with the world, maybe through the shopping, play, swimming, all these outdoor activities.
Right.
We are encouraging from the ministry to minimize those outdoor, you know, these little children going to play out there. You never know. Let's keep them home
Right.
and take this time to bond with our children. Who knows? Perhaps also it's a good time to bond with our children. If you
Indeed.
are working from home, as Daktari is saying, you're there with your laptop or with whatever you use, it is important. On this learning thing, I also want to announce here that I've gotten information that is very critical. Kenya Institute of Curricular Development. This is KICD, which used to be called KIE, Kenya Institute of Education, has, through their website, provided schedule for learning at home from class 5 all the way to Form 4 through the radio English service, radio, KBC English service. If you go and log in, you will find that there is a timetable that people are being taught through audios.
Right.
Class 5, and that timetable is there Monday, Tuesday, Wednesday, Thursday, English service of KBC. www.kicd.ac.k. You'll find that information there.
Okay.
And I try to share that on my Facebook once I live here.
Okay.
And also leave that information with you
Sure.
to know how you can share it on your informations. Otherwise,
right.
thank you very much for having us today in the morning.
All right, thank you so much, Zachary
Thank you.
Kinokia, the Chief Administrative Secretary at the Ministry of Education, as well as Dr. Massimo Ngangi, the Chief Administrative Secretary at the Ministry of Health. Thank you so much for making time
Thank
for
you.
us and
Thank you.
engaging this information dispensation, or what am I saying? What is the word? Sharing information, important information.
Dissemination.
Yes, dissemination is the word that I needed. So we take a short break, but we have to release our guest here. When we come back, we'll be having more stories in as far as what you need to know. Also, Willis Rabru will be in studio, also looking at comedy at such times that we are scared of the pandemic. Back in a moment.